Thank you so much for being here today and welcome to the 2025 Triage Health webinar series. Today's topic is what to know about taking time off work. Today's webinar will be presented by Triage Cancer's Chief Executive Officer, Joanna Duran. Joanna is a cancer rights attorney, and she has spent nearly 30 years working on behalf of individuals with cancer. And she has presented nearly 1,000 educational seminars on employment, insurance, healthcare, and advocacy issues. She co-authored a book on cancer rights law for the American Bar Association called Cancer Rights Law: An Interdisciplinary Approach. Thank you, Joanna.
Thanks, Shelby. So today we're going to talk about what you need to know about taking time off work. Now that could be taking time off for a short period of time, like a few days or weeks, or it could be taking time off for a more extended period of time, like months or even years. It's very important that you understand all of your options related to work before you make any decisions around taking time off, including how those decisions might impact your ability to access health insurance and other benefits, as well as how those decisions will impact your income and overall finances. At Triage Cancer, we're often asked to share information about how to address the financial hardship that comes with a cancer diagnosis. But solving for financial hardship is not straightforward. And that's because there are a lot of contributing factors to the financial hardship caused by cancer. Certainly, there's a lot of focus on the cost of care, which is a significant factor. And we think that the number one contributing factor to financial hardship is not having adequate health insurance coverage to cover that cost of care where you have high out-of-pocket costs. But the truth is, even if cancer treatment were free, there could still be financial hardship. Because if someone needs to take time off work to get treatment, that loss of income is going to have an impact on their financial situation. And so today we're going to talk about options for taking time off work that may also provide some job protection and even health insurance protection. There's a huge amount of data that illustrates the impact that cancer can have on an individual's ability to work in their career, but also how that impact extends to their financial situation. So this is just some highlights of that data. And we know from different research studies that somewhere between 24 and 94% of cancer survivors continue working or return to work. Now that sounds like that's all over the place. So it really speaks to the number of people who are actually trying to figure out how to balance work and a cancer diagnosis. But even where there are legal protections, people might not know about them. 50% of people covered by the FMLA don't know that they have access to it. And 72% don't take FMLA leave because they can't afford to. And it's important to keep in mind that not everyone has access to some of these legal protections that I'm going to talk about today. For example, about 40% of Americans are not actually eligible for FMLA leave. So let's jump into some of those legal protections. But I'd like to start by introducing you to Janet. Janet's 62. She's been diagnosed with cancer and has been receiving chemotherapy treatment for about a month. She's worked for a large public relations firm for 8 years in Michigan, earning about $65,000. She's worked through her treatment so far, but the side effects of treatment are making it difficult to work. And those side effects include fatigue, difficulty concentrating, and neuropathy in her hands where she feels pain and sometimes numbness. Her employer doesn't know about her diagnosis, but has made some comments about her work product recently. Janet's worried that her employer might let her go because she's almost 65. She has 4 weeks of vacation left and 2 weeks of sick leave, and she wants to keep working because she needs her job and the benefits, but she's wondering if maybe she should just take time off while she's in treatment. She's actually so stressed by the whole situation that she's considering just retiring early, but doesn't know if that's a good idea financially or not. So what are Janet's options? Please keep in mind Janet's situation, and we will come back to her later to talk about her options. When we talk about the law, figuring out the options that someone has is like putting together a puzzle. and the pieces of that puzzle are going to be specific to that individual. So everybody's completed puzzle is going to look differently. The individual puzzle pieces could be the federal laws that apply to them, and then the state and local programs and laws that they have access to. What do their specific employers' policies and benefits look like? What types of insurance do they have or have access to? What does their existing financial picture look like? All of these pieces are going to make up someone's puzzle, and I'll show you how all of these different puzzle pieces can fit together for someone. Now, if an employee needs to take time off, they have a few different options or puzzle pieces. And those options vary based on if the person taking time off work is the person with the medical condition or if it's a caregiver. Today's presentation is going to focus on the options for an employee diagnosed with cancer. We know that an employee balancing a cancer diagnosis with their employment may have to battle some assumptions. Sometimes it's their own assumptions about whether they're able to continue to do their job while going through treatment, and if there's anything available to help in that process. Employers also make assumptions about their employees' ability to continue working through treatment and if they can keep doing their job in the same way, and whether or not there's legal options available to help. And healthcare professionals are also making some assumptions about what their patients want and need to do with respect to work. Sometimes healthcare professionals tell their patients to go out on disability, but the truth is that disability insurance isn't actually available to everybody. And not everybody can afford to take time off work and may need to work. And some people actually want to work because they actually like their job and it grounds them and gives them access to a support system. So there may be a lot of reasons why someone might want to continue to work through treatment, but they still may need to tap into some options that can allow them to take time off. So the bottom line is that we really want people to know what all of their options are related to employment so that they can choose their best path forward. There's actually a lot of places to go for information about your employment rights. There are laws that we call fair employment laws that protect people against discrimination in the workplace based on their medical condition and give them access to reasonable accommodations. And we'll talk more about those in just a few minutes. Those fair employment laws exist at the federal level, like the Americans with Disabilities Act or the ADA, but they also exist at the state level. There are also laws that we call leave laws that allow you to take time off work and provide some job protection and sometimes even some health insurance protection. And again, those can exist at the federal level, like the Family and Medical Leave Act or FMLA, but they can also exist at the state and even county or city level as well. And then we sometimes forget that we work under an employment contract. For example, if you're a member of a union, your union bargaining agreement is actually going to provide some additional information about whether or not certain benefits apply to you. Sometimes those agreements give you access to additional benefits, but then may also waive access to other benefits. For example, teachers who are often members of a union may have access to a union or an employer-sponsored retirement plan, and therefore they don't pay into the Social Security retirement system. But because they haven't paid into the Social Security retirement system, they can't actually draw on Social Security disability insurance because they haven't paid into the system. But most people don't realize that until they go to apply. So this is just one example of where it's important to also look at those agreements and contracts to understand your specific rights and benefits at work. And then it's important to remember that the laws just provide the bare minimum of what benefits employers are required to provide to their employees. But there are many employers that are providing options and benefits that are much better than that bare minimum under the law. So it's important to look at your employer's specific policies as well. And those policies could include things like, do you have access to health insurance coverage or dental or vision insurance? Maybe you have access to disability insurance or even a life insurance policy. And important to our conversation today, an employer might also have additional ways to take time off of work. In most cities and states across the country, employers are not legally required to offer paid sick leave. So if they're offering that benefit, that may be something that they're choosing to do to offer to their employees. Employers in most states are also not required to provide vacation time. However, they may offer vacation time or even general paid time off, referred to as PTO. Employers might also have very helpful leave policies. For example, they can allow coworkers to donate their leave time to each other, so that if you are an employee who needs to take time off and you don't have enough accrued paid leave, maybe your coworker can donate that time off to you. A company might also have policies like flex time or job sharing or even telecommuting that make it easy for you to tap into to be able to balance work and a cancer diagnosis. Is there a policy where your employer will hold open your job for you if you're on leave for a certain period of time? Or do you have access to the ability to take unpaid leave beyond any paid leave that you have accrued? And there may also be information about whether or not your employer has laid out a specific process to ask for medical leave or reasonable accommodation. These benefits and rules can often be found in an employee handbook or manual or some type of policies and procedures document. But if you don't have access to written policies, then you can talk with your human resources representative or whomever at work handles your employee benefits. There are a couple of things I want to address up front when talking about fair employment laws. Sometimes patients will say to us, well, I'm an at-will employee, meaning I can be let go at any time for any reason. And generally that's true, except for a discriminatory reason. Being an at-will employee doesn't allow an employer to discriminate against you. Fair employment protections against discrimination apply the same way to part-time employees as they do to full-time employees. And temp employees are protected both when they're working with the temp agency, but also when they're placed with any particular employer. Where independent contractors may potentially be waiving some of the rights of an employee in their contract, so they need to look specifically at that document to see what protections they have access to. Undocumented immigrants are actually protected under fair employment laws, but this is a situation, I think, where the law actually provides some protection, but on a practical level, it's harder for people to actually use those protections because then they might face retaliation from an employer if they try to enforce their rights. Now, turning to the Americans with Disabilities Act, or the ADA. The ADA is a federal law that prohibits discrimination against people with disabilities in lots of different contexts. People may be familiar with the ADA's requirements like accessible parking spots or accessible bathrooms or ramps into buildings for individuals who use wheelchairs. But there's an entire section of the ADA called Title I, which focuses specifically on employment. And that's what I'm going to talk about here today. Title I of the ADA is enforced by the U.S. Equal Employment Opportunity Commission, or the EEOC. And some people who are diagnosed with cancer don't actually consider themselves to have a disability, and therefore wouldn't think that they would be protected under the ADA. But this is one of those situations where we suggest that people not get too caught up in labels, because you might then miss out on some protections that you're entitled to. The ADA can protect individuals with a cancer diagnosis, but not everyone is going to be eligible for protection under the ADA. Like many laws, there are certain requirements that need to be met in order to use the protections included in the law. And the first is that you have to work for a private employer with 15 or more employees, or for a state or local government. if you're a federal employee, you're more likely going to be covered under the Rehabilitation Act of 1973, which is very similar to the ADA and its employment protections. So in addition to working for the right-sized employer, you also have to be qualified. And legally, that means an individual who can perform the essential functions of the job with or without a reasonable accommodation. Practically, what that means is that you're qualified for the job and you can perform the essential functions of that job. But you can get help to do that through an accommodation, and we'll come back to accommodations in a few minutes. And finally, you must have a disability within the ADA's definition of disability. Now, almost every law and program that we talk about has a different definition of disability. So you have to understand what that means under each law. The ADA defines a disability as a physical or mental impairment that substantially limits one or more major life activities. So let's break that down. First, you have to have a physical or mental impairment or condition. And second, it has to limit a major life activity. And third, that limitation has to be substantial. It can't be minor. It can't be something that happens once in a while. It has to be a substantial limitation on a major life activity. So then what's a major life activity? It's anything that the average person in the general population can perform with little or no difficulty. So major life activities are things that are major. Breathing, walking, talking, eating, sleeping, concentrating, and the operation of major bodily functions can all be considered major life activities. And as you can imagine, those are all things that are commonly substantially impacted by cancer treatment, making it easier to show that you actually qualify for protection under the ADA. But often it's not the cancer diagnosis itself that creates the disability under the law, but it's actually the side effects from treatment that someone's experiencing that are impacting major life activities. And when we look to see whether or not someone has a disability under this definition, we're required to do that on a case-by-case basis, meaning we're looking specifically at how an individual's medical condition is impacting them. So we don't classify certain groups of people as having a disability. Once you've shown that you work for the right employer, that you're qualified, and that you have a disability under the ADA, there are 4 ways you can actually use the ADA's protections. And the first is that you currently have that physical or mental impairment that substantially limits a major life activity. The second is that you have a history of having that impairment. So this can be useful for someone who's had cancer and may not be substantially impacted anymore, but is concerned about being treated differently by an employer or a potential employer based on their past cancer diagnosis. They would be protected against discrimination under the ADA. The third way isn't really about you at all, but it's about your employer's perception of you, where your employer is regarding you as having a disability and treating you differently because of that belief. And this really goes to the heart of discrimination. And then the fourth way that you can be protected is based on an association with the person with the disability. And this is where caregivers can be protected from discrimination under the ADA because of the associating with the person with the disability that they're caring for. For example, an employer might think that a caregiver is going to be distracted or take too much time off, or maybe they're not going to promote a caregiver because they think that caregiver wouldn't want additional workload or a new assignment or a promotion even. In these circumstances, an employer can't discriminate against a caregiver for associating with the person who they're caring for. And that's really the bottom line of the ADA's protections against discrimination, is that an employer can't take into consideration someone's medical condition or their status as a caregiver when making employment decisions. And those employment decisions are things like hiring, firing, benefits, promotions, bonuses, assignments, schedules, and lots of other things that employers might be making decisions about. They are not supposed to take into consideration someone's medical condition when making those decisions. Now, the ADA applies to all phases of the employment process, which means it doesn't just provide protections when you're hired as an employee, but it also provides protection when you're a job applicant. So even before you get the job, you're entitled to protection under the ADA. And regardless of how you use the ADA, it's going to provide protection against discrimination in the workplace. But the ADA can also provide another benefit. If you currently have a disability under the ADA or have a history of having a disability, in addition to being protected against discrimination, you're also entitled to reasonable accommodations. So what are reasonable accommodations? The legal definition is any change in the work environment or in the way things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. But I know that's not very clear. Practically speaking, a reasonable accommodation could be anything that's going to help you stay at work, return to work, or even take time off of work. But the best way to talk about reasonable accommodations is to give you some examples. And when it comes to dealing with a cancer diagnosis at work, we've grouped some of the most common types of accommodations into three main categories. And the first is about physical workspace. So this could include moving offices or using special equipment or furniture to do your job. For example, for someone who's experiencing neuropathy or pain in their feet and driving a car or a truck as part of their job, they could get hand controls on their vehicle. Maybe it's asking for a closer parking spot or moving your workspace closer to the restroom. I think that most people think about telecommuting when they think about accommodations. And telecommuting might mean working from home, which many of us have become more familiar with, but it might also just mean working from another location than when you normally work. And that could be important for a variety of reasons. It might save you time and energy spent in a commute. So maybe you're working in an office that's closer to where you live than where you normally work. Or maybe it is about being able to work in a location that is closer to where you're receiving treatment. So it makes your ability to schedule appointments around your workday easier. And then the second category is about a change in schedule. There are different ways to adjust schedule as a reasonable accommodation. It could be about adjusting hours or changing shifts. If you do shift work, it could be about having a more flexible schedule or additional breaks during the day. It might also be about taking extended time off, which we're going to come back to related to our topic today. And then the last bucket is everything else. So maybe it's about using technology. So for someone who is dealing with that neuropathy or pain in their hands, and they spend all day typing, maybe using speak type software is going to be helpful to them. Maybe it's about a policy. So for someone who works in an environment where there's a strict dress code and they need to be able to wear warmer clothing because of temperature sensitivity, could there be an exception to that policy? It could also be about shifting responsibilities. So for an elementary school teacher who's experiencing extreme fatigue, but can still teach their class, if that teacher's asked to staff the drop-off line in the morning and supervise after-school activities, maybe those extra responsibilities can be shifted to other employees so that during those times, the teacher can rest and focus on teaching. And finally, it could be about changing jobs entirely within a company. Now, this only works if there's a vacant position at the company to move to. Employers aren't required to create a new job for somebody, but if there is an open position that the employee is eligible for, they could receive an accommodation to move to that position. Now, when thinking about what accommodations are possible, it's important to think about what's actually posing a challenge at work and what types of accommodations might be useful. These are just some examples of the types of side effects that someone might experience and possible accommodations to address those side effects. The Job Accommodation Network, or JAN, is a program funded by the US Department of Labor, which specifically exists to help employers and employees navigate the accommodations process. They have a very useful tool on their website, which is askjan.org, called the Situations and Solutions Finder. And in this tool, you can actually put in the type of side effects someone's experiencing and their type of job, and it will list potential reasonable accommodations that other employees have received in the past. So I think for someone who's struggling to figure out what's going to be helpful for me, this tool is a great starting point to come up with some ideas about what might actually be helpful. I'd like for you to meet Olivia. After Olivia was diagnosed with cancer of the tonsils and larynx, she decided to work through her treatment. She works as a cashier at a large supermarket chain. She hasn't told anyone at work about her medical condition, and she took 2 weeks of vacation time for her surgery and recovery. She's now in her 3rd week of chemo and is having trouble with fatigue and is limited in how long she can stand at a time. She also has to constantly drink water because of the effect of the treatment on her salivary glands, and as a result of the large volume of water she consumes, she has to urinate frequently. The supermarket does not allow employees to have beverages at the checkout stand, and she's only allowed breaks every 4 hours. Olivia doesn't know what to do. So Olivia's situation is actually based on a real case. And in her case, she received a few different accommodations, including an exception to have beverages at the checkout stand. And her supervisor also told her that whenever she needed to use the restroom, to contact the supervisor, who would then fill in for her at the checkout stand. But then one day there was a new supervisor at the store who wasn't informed about the accommodations, and he told her that she needed to wait when she asked for a break to use the restroom. A little while later, she asked again, and he wasn't available. And ultimately, this led to a really traumatic experience for her, and she ended up taking her situation to the EEOC, which thought it was such a good example of how easy it is for employers to accommodate employees that they actually took the case on her behalf. And so it's important to think about someone might be experiencing lots of different side effects, and that there could be multiple accommodations available to help address those side effects. But employers are required to provide accommodations to eligible employees, unless those accommodations might be an undue hardship or a direct threat. Those are actually pretty high standards for the employer to meet. And so while they are exceptions to the requirement that employers have to provide accommodations, they're very limited exceptions. When talking about some accommodations, there are practical tips to know. Sometimes we hear from patients that my employer's been really helpful and really supportive, and I hate to ask for one more favor. But a reasonable accommodation is not a favor. Employers are required to provide them. That being said, they do have to be reasonable, which is going to be very specific based on your job and your employer and your specific needs. What might be reasonable for one employee might not be reasonable for somebody else. A bus driver probably isn't going to be able to telecommute their bus route. So it has to make sense based on your job responsibilities. Now, the great thing about reasonable accommodations is they're pretty flexible. The law says any change at work. So that means everything is on the table as long as it's reasonable. And you can be creative in thinking up potential solutions to what's posing a challenge for you at work. It might be that you need to get more than one accommodation to deal with everything that you've been coping with. So don't feel like you have to have one accommodation that solves all the challenges that you're experiencing. You might be eligible for 2 or 3 different accommodations to address side effects that you're experiencing. I do want to mention that while caregivers are protected from discrimination at work, they're not entitled to reasonable accommodations under the ADA. Even though you could probably think of lots of practical examples of how accommodations could be useful to caregivers. But I think that this falls into the category of it can't hurt to ask, because we know employers want to keep valued employees, even if that employee is the caregiver and not the employee with a disability. The Job Accommodation Network does a survey about every other year where they look at the cost and the effectiveness of accommodations and why they're beneficial to employers. And what they find almost every single time is that about 56% of accommodations cost the employer absolutely nothing at all, which is important because many employers think that accommodations are expensive to provide. And then about 37% of accommodations have a one-time cost of about $300. So maybe that's purchasing the software that someone might need or a different uniform. But the benefit to employers is significant because they get to keep those valued employees. They don't have to deal with the cost of hiring and retraining. It increases attendance. And then because employees see an employer accommodating other employees, there's often an increase in overall employee morale. So again, accommodations can be mutually beneficial, and that holds true even when the employee is the caregiver. So when I suggest it can't hurt to ask when a caregiver goes in with the idea that what might help them stay at work and be productive and propose that to their employer, it can be beneficial to the employer as well. Asking for accommodations brings up a number of practical questions about how do you actually go about doing that? Employees should always ask for an accommodation as soon as they realize they need one. Because if an employee doesn't ask for an accommodation and whatever they're coping with starts to affect their job performance, then the employer may end up making decisions like demotions or firing based on that job performance. How do you go about actually asking for an accommodation? An employee doesn't have to invoke the ADA or specifically use the words reasonable accommodations in order for the employer to be required to provide the accommodation. But even though an employer should really understand what the employee is asking for, we often see employees in the position of being required to educate their employers about what their responsibilities are under the law. So Jan can be a valuable resource to help with that. But practically speaking, if an employee asks for an accommodation and doesn't use the words reasonable accommodation and the employer says no, then one first step might be going back to the employer and actually using the words reasonable accommodation. Who do you ask for the accommodation? An employee can ask the person at work that they feel most comfortable in asking, but we recommend that employees first look at the employee manual to see if the employer has laid out a specific process for asking for those accommodations. Some employers require that you start by going to human resources or HR. But if there isn't a specific process laid out, then an employee could take into consideration their workplace and its culture. So if an employee's direct supervisor is their biggest advocate, then maybe starting with the supervisor is the best way to start. But if the employee is concerned about how their supervisor might respond, then maybe it's better to start with HR. So it can depend. When an employee asks for an accommodation, an employee's medical condition is supposed to be kept confidential by the employer. So the employee's supervisor isn't supposed to announce it at a staff meeting. But it is important to realize that in some cases, it may be necessary for an employee's supervisor or superior to be made aware of the accommodation. For example, if you go to HR and negotiate a reasonable accommodation to take every Friday off so that you can go to treatment, the supervisor needs to be told that you've been given an accommodation, but they're not entitled to know why. Someone's need for an accommodation could also change over time. What someone might need a few weeks after surgery might be very different than when they start chemotherapy or radiation treatment, or if they have a recurrence even. And employers are required to provide reasonable accommodations that are effective for the employee, even when those needs change over time. When an employee first asks for an accommodation, employers and employees have to engage in what's called the interactive process. And this is a process that was defined by the EEOC, and it's rarely this formal in reality, but essentially it's a back and forth conversation between the employer and the employee to come up with an effective accommodation and then to monitor it to make sure that it continues to be effective. And if at any point it stops being effective, the process starts over again. Employers and employees are required to engage in this negotiation. So if an employee says to their employer, I need an accommodation of telecommuting, the employer just can't say no, period, and then walk away, because that's not engaging in the interactive process. But your employer can say, I'm sorry, I can't tell you yes because you're a school bus driver and you can't telecommute your bus driving job. But if you're experiencing extreme fatigue in the morning, I can assign you to the afternoon shift instead of the morning shift. Would that work for you? And then they can go back and forth until an accommodation is agreed upon. And then there needs to be that ongoing assessment of it if it's still appropriate and effective. Generally, the employee has to be the one to ask for the reasonable accommodation from an employer. But there have been some cases where courts have ruled that employers are responsible to offer accommodations, specifically when an employer becomes aware of a need for an accommodation and knows of the individual's medical condition, or when an employee exhausts protective leave and needs further leave. And we're going to come back to that in a few minutes when we get to the FMLA. So the employer is obligated to engage in this dialogue around what is going to be an effective accommodation during the interactive process. And there are no magic words that the employee has to use. When thinking about what is posing a challenge for you at work, when we're talking about accommodations and the side effects that you might be experiencing, it can be helpful to think about, are they side effects that you should be talking to your healthcare team about? Because some side effects can actually be managed through medication, or there might be complementary therapies that could be recommended to help address some of those side effects. And then there are the things that people can do on their own on a very practical level to help manage their side effects at work. For example, if someone's experiencing cognitive challenges or trouble focusing or short-term memory loss, there are practical things that people can do to manage those side effects so that it isn't impacting them at work. Whether it's utilizing technology like noise-canceling headphones or software to stay organized, or even just taking notes in a way that they wouldn't have done in the past because they didn't need to. But when somebody actually needs help at work from their employer, that's a reasonable accommodation. And so we want people to understand that there are differences between the things they can do on their own, where their healthcare team can provide help and support, and where their employer is providing accommodations. When So to summarize our conversation around accommodations, we always encourage people to be careful of assumptions that I talked about before, as there may be tools that can help someone at work. And to make sure that you're considering the details. What are you actually responsible for at work? And how is your medical condition impacting your ability to do your job? Because those details are going to drive what accommodations you could potentially ask for to address those side effects. And you get to be as creative as possible because, as I mentioned, the law says any change, which means everything's on the table unless it's not reasonable or it poses a direct threat or undue hardship. So you can think about all the potential things posing challenges at work, then all the potential things that could help address those challenges. And when you go into a conversation with your employer, you can be prepared with a whole list of reasonable accommodations. And because it makes it easier to show the employer that you're committed to finding a solution, because you've actually thought through a potential solution as opposed to just going into the employer and saying, I have this problem. If you can propose the solution, it makes it a lot easier for the employer just to say, sure, that sounds great. We do sometimes get asked if you have to get a reasonable accommodation in writing. And the answer is no, it's not required, but it can be very helpful. When you think back to Olivia's situation, if she had had a copy of that accommodation in writing, she could have shown the new supervisor the document in that moment, and it could have avoided the whole situation. So sometimes it can be very helpful to actually have some documentation of what was agreed upon. But it doesn't necessarily have to be something formal. If you normally communicate with a supervisor or an employer over email, you could just go back to your computer after your conversation and send a quick email that says, thanks so much for talking today. I'm glad we were able to come up with X, Y, and Z. I'll keep you posted on how it's going. Even that informal recap of the conversation and what was discussed and agreed upon can be useful to create a paper trail to avoid confusion in the future. As I mentioned earlier, most states have a state law that is very similar to the ADA, but some states are actually more protective than the ADA. For example, some states may have a broader definition of disability, where they only require any limitation on a major life activity, as opposed to the ADA, which says it has to be a substantial limitation. Another way that the state laws are more protective is that they cover smaller employers, where the ADA only covers private employers with 15 or more employees. So this chart shows the number of employees the states have in their requirement to be covered under the state fair employment law. So this means that if you work for an employer with fewer than 15 employees, you're actually not covered by the ADA. So it's important for you to know if your state has a state fair employment law that does cover your employer. For example, if you live in Illinois, your employer only needs one employee to be covered by state law. If you're in Massachusetts, your employer needs 6 or more employees. If your state isn't listed here, then it's actually the same as the ADA. So it covers employers with 15 or more employees. States, counties, and cities have a wide range of leave laws that allow employees to take time off work for a variety of reasons. Everything from family and medical leave to time off to vote or to serve on a jury. So it can be valuable to understand what's available to where you live specifically. You can find more information about state and local laws on our state resources page and on our charts of state laws on our website. And this is an area of the law that is constantly changing as states and counties and cities make different decisions. Sometimes they're actually providing new protections, and sometimes they're making decisions to take away legal protections. To give you some examples of leave laws that might be useful, 12 states currently have state family and medical leave laws, which offer unpaid leave to care for a family member with a serious health condition. 3 states have laws requiring employees to provide paid leave for any reason, so it's just referred to as general leave. About 20 states have kinship laws where an employee can use their own sick days to care for family members. And 2 states actually have laws that provide unpaid leave specifically for taking a family member to a routine medical visit. So these laws at the local level can be very different and provide some additional benefits that you may not be aware of. Now, the Family and Medical Leave Act, or the FMLA, is a federal law that's enforced by the U.S. Department of Labor's Wage and Hour Division. And the FMLA allows eligible employees to take time off for their own serious medical condition or to care for a child, a parent, or a spouse with a serious medical condition. And that's a pretty narrow definition of family members whom you're allowed to take time off to care for under the FMLA. It's only spouse, parent, or child. So you can't take time off to care for a grandparent or a parent-in-law or a sibling. It's just spouse, parent, or child. There have been some efforts to expand access to the FMLA in Congress, but nothing has been successful up to this point. Generally, someone with a cancer diagnosis is going to qualify for protection under the FMLA, but we sometimes get asked what qualifies as a serious health condition under the FMLA. So a serious health condition is an illness, injury, impairment, or physical or mental condition that involves either inpatient care in a medical facility or continuing treatment by a healthcare provider. And that continuing treatment generally covers when someone has a period of incapacity of 3 or more days and has ongoing care from a healthcare provider. Besides having a serious medical condition or caring for a spouse, parent, or child with a serious medical condition, there are some other requirements to use the FMLA's benefits. Under the FMLA, an employee must work for a public employer of any size, like for a federal, state, or local government, or work for a private employer with 50 or more employees. But it is 50 or more employees who work within a 75-mile radius of your work site. So that's a pretty nuanced definition, but basically what it means is that if you work for an employer with multiple offices or locations within 75 miles, you get to add up all the employees at each of those locations to meet that 50 plus requirement. So this can be really useful. And I think a lot of people sometimes assume that they don't have access to the FMLA because they just work in a small office, but maybe they work for a larger company. So we want people to double check to see if they qualify for protection. Employees also have to work for their employer long enough, meaning that the FMLA requires employees to work for their employer for at least 12 months. And you have to work for that employer for at least 1,250 hours during the last 12 months that you worked for the employer, which comes out to be 24 hours a week if you worked all 52 weeks during the year. For the hours requirement, it's only hours that you actually worked that count. You don't get to use sick time to meet this requirement. For the month requirement, it's a little more flexible. The 12 months don't need to be consecutive, only cumulative. So for example, there are lots of industries where employees come and go from their employers the FMLA allows employees to go back 7 years in their work history to meet that requirement. For example, if you worked for your employer for 5 months and then you leave, and 3 years later you go back and work for that employer, once you've worked there for 7 months, you'd actually be able to take FMLA leave because you have credit for the previous 5 months that you worked for the employer. So you'd be able to access the FMLA leave as long as you've met the hour requirement as well. So the bottom line is that as long as the employee has worked for the qualifying employer for a total of 12 months or more in the last 7 years, and you've worked 1,250 hours in the last 12 months, then you would be eligible to take FMLA leave. So what does the FMLA actually do for you? It entitles you to up to 12 weeks of leave per year. Every 12 months, you get access to 12 weeks of leave. The downside is that it's unpaid leave, and most people can't afford to take FMLA. So really, the major benefit of the FMLA is that it puts you in what we call this protective bubble. You're protected from losing your job. And we sometimes forget that if we're just taking a sick day or a vacation day, nothing about those provides job protection. They're just about replacing wages. So if you're taking a lot of sick time, your employer could potentially take that into consideration and let you go. Whereas if you're taking that time off under the FMLA leave, it's job protected leave, and your employer can't take that into consideration. It also protects your health insurance in that if you get your health insurance coverage through your employer, whatever the situation is when you are employed has to continue for the period of time you're on leave. So if the employer normally pays 50% of your health insurance premiums and you pay 50%, they have to keep doing that while you're taking time off under the FMLA. They can't force you to take COBRA coverage during the FMLA, for example. So there is some nuance to actually using the FMLA. And the first is that it's actually pretty flexible. You can use the FMLA in smaller segments of time than that full 12-week block of time. So maybe you're going to use a couple of weeks off for surgery and recovery. And then when you start chemotherapy appointments, you take 1 day off a week. If you start radiation, maybe you're just taking 4 hours off a day for your radiation appointment. So it can be very flexible how you use the time for a total of 12 weeks in a 12-month period. You can also use it intermittently, meaning that you might not know when you're going to need it. But on a day that you're not feeling well and you call in sick to work, you can use that as FMLA time so that you get access to that job and health insurance protection. But when we say it's 12 weeks of leave per year, when does that year begin and end? If an employee comes to me and says, I've used up my FMLA time, but my doctor says I'm not ready to return to work and I don't know what to do next, my first question is going to be, what's your year period? Because maybe your year period restarts next week and we can just figure out how to bridge the gap until next week. It's up to the employer to decide what the year period is, and there are actually 4 choices. So they can choose from a calendar year. They can choose a year rolling backward from the date that you asked for leave. So if you ask for leave today, they're going to look back over the last 12 months and see how much you've used and give you the balance moving forward. Or a year rolling forward. So if you ask for leave today, they're going to give you 12 weeks over the next 12 months. Or it could be any fixed 12-month period of time, like a fiscal year, for example, or your anniversary date. So the employer gets to choose, but the employer does have to choose and apply it the same way to all employees. So asking what your year period is crucial to understanding when your FMLA leave begins and ends, and also when it's going to reset. There's also a notice requirement if you want to use the FMLA. So for leave that's foreseeable, you're supposed to give your employer 30 days notice. meaning that if you're going to have hip surgery in January, you're supposed to tell your employer at least 30 days ahead of time. But most of the time, when we're talking about the need for medical care, the need for leave can be unforeseeable. So you're supposed to let your employer know as soon as practicable, which is the legal standard. But basically, that comes out to be, 1 to 2 business days, or as soon as possible, let your employer know that you need to take FMLA leave. Now, we've been hearing more and more that employers are requiring their employees to use their vacation time or sick time or general PTO time before they get access to the FMLA. And what's the problem with that? It's preventing you from accessing the job protection in the FMLA. General PTO doesn't come with job protection. So saying that you have to use that first before you get the job protection is actually impeding someone's access to the FMLA, and employers aren't allowed to do that. If someone's eligible for FMLA leave, an employer can't deny them that leave. When a patient comes to me and says, I have sick time, I've got vacation time, I've got disability insurance, and I have access to the FMLA, I want to string them all out to be off work as long as possible. Can I do that? The answer is it depends, because an employer is allowed to require you to substitute the unpaid leave under the FMLA with any accrued leave that you have. So, for example, if you have access to vacation time and sick time, it is going to run at the same time as your FMLA leave. So you're using them concurrently, which does actually provide some benefit because the accrued leave is what's paying you, while the FMLA is providing the job and the health insurance protection. But it does mean that you can't string it all out. However, if an employer doesn't require you to do that, then the answer is sure, you could do that. Or if you want the ability to use that paid time off and the FMLA concurrently, you can request that, and your employer has to give that to you. Now, this is where those puzzle pieces I mentioned start to fit together. The ADA and the FMLA can work together. If you've used up your FMLA leave and you're not able to go back to work, you could potentially ask for additional time off as a reasonable accommodation under the ADA or a state fair employment law. But all the court cases on this topic have said so far that the additional time off as a reasonable accommodation has to be for a definite period of time. So if you call up your employer and say, I know I've used up my FMLA leave and I have no idea when I'm coming back to work, that additional time off is not likely to be seen as a reasonable accommodation. But if you call up your employer and say, my physician has released me to come back to work in 4 more weeks, I'd like those additional 4 weeks as a reasonable accommodation, that's more likely to be seen as a reasonable accommodation. So the ADA can be a supplement to the FMLA, but it can also be something you use instead of the FMLA. Why might you use the ADA as a way to take time off through a reasonable accommodation instead of the FMLA? Well, what if you don't qualify for the FMLA? I told you earlier that about 40% of people in the United States don't actually have access to the FMLA. So that's why I spent a significant amount of time talking about the ADA and reasonable accommodations, because for that 40% of people, they may have access to taking time off as a reasonable accommodation through the ADA or a state fair employment law. And so this is just yet another example of why it's so important that people understand all of the options that are available to them, because if they learn about an option that doesn't apply to them, they should know about the other things that might. So if somebody is taking time off work, particularly under the FMLA, there are some important things to think about on a practical level if you're going to take time off, especially if it's for a longer period of time. So you need to understand how much leave you're actually entitled to and which law or policy you're taking it under so you know what your rights actually are. You also need to know if your employer requires you to submit a medical certification form. So some version of a doctor's note that shows why you're eligible for taking leave. So on a practical level, what is that form? How do you actually access the form? And then being able to take it to your healthcare team to complete it. And then you want to know if your employer is going to pay your health insurance premium. So if your employer pays 100% of your health insurance premium, this is less of a concern. But if you contribute to a portion of your health insurance premium through your paycheck, and you aren't getting a paycheck for the period of time you're on FMLA leave, how are you actually paying your health insurance premium? And every employer handles that differently. So some employers will just pay your premiums for you for that period of time, and then you have to pay that back once you come back to work. Some employers are going to ask you for another way to contribute to that premium, whether it be a hard copy check or an ACH transfer from your bank account. So asking questions about logistically how that's actually going to work is very important for while you're taking FMLA leave. And then the same thing about if you have access to other benefits and you're responsible for paying for that out of your paycheck. So things like vision or dental or disability insurance or even a life insurance policy. You want to proactively think about how you're going to make those payments and then how you actually make sure you continue to have access to those benefits. Then your employer might also have rules about what you can do while you're taking time off work. So are you allowed to use your work email or phone or computer? Are other employees allowed to contact you for questions? They might have very specific rules about what you're allowed to do or not allowed to do while you're taking leave. So you want to find that information out ahead of time. But with respect to rules about what an employer can and can't do while you're on FMLA leave, an employer is allowed to check in with an employee who is on FMLA leave, but in specific ways. So an employer can ask if there are going to be accommodations that an employee might need that are going to help for the return to work process. Or they could just confirm that the return to work plan is on track. Or if there's necessary communications about actual work to be able to pass on assignments, for example. But an employer is not allowed to check in repeatedly to pressure an employee to return to work. So there's a difference between supporting the employee and harassing the employee. I do want to mention a few other employer obligations under the FMLA and ADA specifically related to taking time off work. Employers can't force employees to stay at work if they are eligible for the FMLA. And employers also can't require an employee to take ADA leave instead of accommodations that are optional or possible to help an employee stay at work. Also, employers can't require an employee to take leave while the interactive process is going on. So the idea is to help people stay at work if that is what they need to or want to do, and the law provides protection to make that happen. There are also very specific rights that someone might have in returning to work after taking time off under different laws. When we're talking about taking time off under the FMLA, an employee might wonder about what protections they have when they return to work. And the FMLA requires that someone return to an equivalent or the same employment. So equivalent has a specific legal definition. And so we've actually included it on the slide. It has to be virtually identical to the employee's previous position. And that means that it's the same pay and benefits and working conditions and responsibilities. But it might not be exactly the same position. And a good example of this is when someone works in sales. So they might have a specific sales territory that they work in. But when they come back to work after taking time off under the FMLA, maybe they have a new sales territory. Everything else about the job is the same. It's just working in a different territory. So that could be an example of an equivalent position. When we're talking about taking time off under the ADA as a reasonable accommodation, when someone returns to work, they are entitled to reinstatement to the exact same job. There's no equivalency language in the ADA. So you get reinstatement to the exact same position. Disclosure and privacy is a topic we spend a lot of time talking about because we find that people don't realize that they have some choices related to disclosure and privacy of their medical information at work. Generally speaking, we are not required to share any information about our medical conditions with an employer or a potential employer. But if you actually want to use some of the legal protections that might be available to you, like the ADA's discrimination protections or accessing a reasonable accommodation or using medical leave, you may need to disclose enough information about your medical condition that actually shows why you're eligible for those benefits and protections. But that doesn't mean you need to disclose a cancer diagnosis exactly. And the reason why is because usually your need for leave or an accommodation is based on side effects that you're experiencing from treatment. And many of those side effects are medical conditions on their own, like fatigue or cognitive function or neuropathy or lymphedema. And if you're concerned about disclosing a cancer diagnosis at work, instead you can share those side effects without tying them back to an original cancer diagnosis. So I want to spend a minute talking about how do you complete those medical certification documents for employers while still protecting your privacy. And it is true that if someone is trying to access accommodations or take medical leave, they may have to complete a form for their employer to show the employer that you're actually entitled to those things. But the specific diagnosis of cancer may not be required on that form. And for individuals who feel strongly about keeping their cancer diagnosis private at work, this could be an important distinction. But it does require communication, because if an employee gets a form from their employer, walks into their oncologist's office, hands the form to their oncologist, and their oncologist hands it to someone on the team to fill out, and there's never a conversation about someone's preferences related to disclosure, and if there's a line for diagnosis, someone is going to fill in cancer on that line because we are a society where we fill in information on lines when asked for that information, even if it's more information than the employer is actually entitled to under the law. And employers can create their own forms, and sometimes they do ask for more information than they're entitled to. So if somebody specifically is in a situation where they're actually asking for medical leave, under the FMLA, there is a model form for FMLA leave that was created by the US Department of Labor. It's only 4 pages long. There's one version if you're taking it for yourself. There's one version if you're taking time off as a caregiver. But there is no line for diagnosis on that form. And in fact, in some states, if you have a state family and medical leave law, that state law may actually require that your healthcare team not disclose the diagnosis on the form. So this is where it's important to have a conversation around preferences so that in completing this paperwork, it actually gets completed in a way that reflects your preferences around disclosure. But even on the model FMLA form, it does ask for the provider's type of practice or specialization. So if you've asked your oncologist to fill out the form and you don't have a conversation, it's likely that the oncologist is going to write oncology on that line. However, we've talked to some oncologists and they've told us that if a patient came to them and expressed concern about privacy, they could write internal medicine on that line instead of specifically writing oncology. And that would be true. It would just provide less information about an individual's specific medical condition. In fact, there is an entire list of healthcare professionals who are allowed to complete the FMLA form. And so this could also be a situation where someone could go to their primary care physician or to a healthcare professional who could speak specifically to the side effect that someone was experiencing. So if someone had neuropathy in their feet, could a podiatrist talk about that on a medical certification form? There are also some specific rules about how employers have to handle medical information. They are not allowed to ask for copies of medical records. If they do receive medical information, like a completed FMLA form, it is supposed to be kept in a separate file than the employee's regular employment file under separate lock and key. And there are rules about when an employer can actually contact a healthcare professional who is completing the medical certification form. Under the FMLA, it's very limited. They can only contact a healthcare professional to authenticate the form, which basically means I think this form might be forged and I'm just checking to make sure you've actually been the one to submit it, and to clarify, which means I can't actually read your handwriting. Can you clarify what it says? Not, can you tell me more about this person's medical condition? The ADA is less specific about when an employer can reach out to an employee's healthcare team, but generally it's not without the employee's permission. So we do have a lot of resources to help people navigate employment-related issues, whether it's accommodations or taking time off or returning to work. So you can find that on our employment resources topics page on our website. I do want to spend a little bit of time talking about disability insurance, because when someone is diagnosed with a serious medical condition, there is often at least some period of time that they need to stop working. And if somebody needs to stop working, they may face a loss of income. And that is where disability insurance comes in. It is a cash benefit that replaces lost wages, but it's typically not 100% of your wages. So depending on the type of disability insurance, it could be anywhere from 45 to 90%. I've only ever heard once from somebody that they had 100% disability insurance policy. So that's pretty unusual. But there are different types of disability insurance. So it could be private disability insurance, where you go and purchase a policy directly from an insurance company. That's actually pretty unusual. People in the United States don't typically proactively buy disability insurance. But if someone has a private policy, it's typically because they get it as an employee benefit through their employer, where their employer is offering them a disability insurance plan. And they usually pay the full premium of that plan. The plan could be short-term or long-term. So short-term disability plans typically are plans that last 6 months to a year, whereas long-term disability plans are typically for medical conditions that last at least a year or longer. In addition to private policies, there are a handful of states that actually offer state disability insurance. Like those private policies, the details differ from state to state. You can find more information on our state resources pages about these benefits and how to apply for them. We also have a quick guide to state disability insurance. And then there are the 2 federal long-term disability programs that are run through the Social Security Administration. And those are Social Security Disability Insurance, which is SSDI, or Supplemental Security Income, which is SSI. So when somebody is trying to make educated decisions about, do they continue working? Do they take time off? Do they apply for disability, or do they retire? there are very clear financial decisions or implications of those decisions. And we want people to be able to understand all of their options and to make educated decisions about what is best for them. One tool in that process is for you to actually look at your Social Security retirement statement. We used to be mailed a paper copy of our retirement statement from the Social Security Administration each year. And it showed a list of every year that we have worked and what we earned each of those years. But it also provides very important information, like what would your retirement be if you were to retire early at age 62? Or what is your full retirement age? Is it 65 or 67 or 68? It depends on the year that you were born. And what happens if you wait until you're 70 to start drawing on your benefits? All of this information can be found in your Social Security retirement statement. As those statements are no longer mailed to you, now you actually have to create an account with the Social Security Administration to get access to your statement. So if you go to ssa.gov/myaccount, you can actually sign up for an account to be able to log in and see your Social Security statement. Now, this is something that everybody should do because you want to make sure that they have the correct record of what you've earned every year of your work history, because that record is what they use to decide how much you get when you retire each month and how much you get from SSDI. So you want to make sure that it's correct and actually reflects what you've earned. When you log into your account, you see immediately whether or not you have enough work credits to start receiving benefits. If you haven't worked long enough, you won't have enough credits to start drawing on these benefits. It will also tell you if you were to become unable to work due to a medical condition this year, exactly how much you would receive each month from SSDI. And you can actually start your disability application directly from in your own account. It will also show you the information about your retirement benefits as well. So you can make an educated financial decision about, do I retire early at 62 and see what I would get each month then? Or should I apply for disability benefits because I'm unable to work due to my medical condition, and what I would get from SSDI each month? Now, when we're talking about these benefits, and this is an example of where these puzzle pieces start to fit together, sometimes people jump to the end. Some people might say, I think I'm going to need to work more than, or take more than 3 months off. So I'm not even going to bother with the FMLA. I'm going to jump straight to disability insurance. But there could actually be a financial benefit to not thinking too far ahead and to think somewhat chronologically about how you use these benefits. Because if your employer pays 100% of your health insurance premium and you don't know for sure how long you're going to need to take time off work, if you take those first 3 months off under the FMLA, then you can actually benefit from the fact that your employer is paying your health insurance premiums for those weeks. So sometimes there's a financial benefit as well to thinking about these benefits, and you don't miss out on some of these protections. Now, I'd like to introduce you to Jane, whose doctor has suggested that she consider going out on disability. But she also has 3 weeks of vacation time, 3 weeks of sick time. Her employer is covered by the FMLA, and her employer offers a short-term disability insurance policy that lasts up to 12 months. What are Jane's options? So Jane could take those 12 weeks off under the FMLA. Then if she needed to replace her wages, she could take the first 3 weeks off as sick time. The second 3 weeks off she could take as vacation time. And then she could tap into her short-term disability plan for the remaining 6 weeks that she needed to be out of work for 12 weeks total. Every one of these laws and benefits is separate and can be used separately. But this is what it starts to look like when you put those puzzle pieces together. The FMLA is providing the job and the health insurance protection. Her sick time and vacation time and short-term disability policy is what is paying her during that period of time off. Now, Mark has access to the same benefits, but he thinks he's going to need to be out of work for 15 weeks based on what his healthcare team is telling him. So what are Mark's options? This time, starting on the money side, he could take 3 weeks off as sick time, 3 weeks off as vacation time, and then use his short-term disability insurance plan for 9 weeks. And then on the job and the health insurance protection side, he could take those first 12 weeks off under the FMLA. But what does he do for the remaining 3 weeks he needs to be off work? He could ask for the additional 3 weeks off as a reasonable accommodation under the ADA. Now, when we talk about people making different decisions, we want them to understand all of these options because they might make different choices. Someone might choose to take vacation time and sick time first before their disability benefits because their vacation time and their sick time gets paid at their full rate of pay, where we don't know in this situation how much the short-term disability plan is going to pay out at. However, if Mark has a really important family reunion coming up where he wants to save his vacation time, maybe he actually saves his vacation and he uses his short-term disability plan for 12 weeks. But that's a choice that he can make if he understands what his options are. We have a lot of resources to help people understand disability insurance, and we have a webinar coming up next month on understanding your disability insurance options. So I encourage you to register for that program. But if you can't attend, you can watch the recording at any time. You also have to think about how all of these work decisions impact your access to benefits. If you had health insurance coverage through your employer, you want to understand your options for insurance moving forward when your job ends, and if you can keep access to the same plan through COBRA or state COBRA. Or do you want to purchase new health insurance coverage through the marketplace? Or how do you convert the other policies that you have access to an individual plan? So we have some resources to help people understand how to figure out their health insurance options, as well as how to make decisions about leaving work. And those resources include an animated video on your options to losing employer-sponsored health insurance coverage, as well as a quick guide. And then we also have resources to help you think about steps to take when leaving work. So we have a quick guide to leaving work that helps talk through the practical aspects of what to do when you're taking time off work, particularly for an extended period of time. And when we're talking about employment, it's also useful to remind people that if they are let go from their job, they may qualify for unemployment benefits. And those benefits are state specific, and you can find information about your state's programs on our state resources and state laws pages. But I want to return to Janet's options for a minute. So remember, she has been thinking about asking for accommodations that might address her side effects that are making it difficult for her to work. So if she wants to continue working, she could ask for those accommodations from her employer. But if she wants to take time off, she can consider asking for taking time off under the FMLA if that applies to her employer, because we don't know what large means. So if it's smaller than 50 employees, Janet might not have access to the FMLA. Then she might need to look at her options under the ADA or a state fair employment law to take time off as a reasonable accommodation. And if she's considering retiring, she can actually sign up for her My Social Security account to see exactly what she would get from Social Security if she took SSDI, retired early, or waited until her full retirement age. So as I mentioned when we started, to recap, when someone needs to take time off work for their own serious medical condition, then they may have access to unpaid or paid leave options. And I do want to mention that caregivers have different options for taking time off work. And to learn more about those options, you can visit our caregiving resources page on our website, where you'll find a number of resources, including a recorded webinar on caregiving resources. So I believe my colleagues have been answering questions in the chat or in the Q&A box while I have been speaking. So I'm going to turn it back over to Shelby.
Thank you so much, Joanna. If you enjoyed today's topic, we invite you to attend the rest of our webinar series. You can see the full schedule and register at triagecancer.org/webinars, and we also post recordings of all of our webinars on our past webinars page. Our flagship event is our Triage Cancer Conference. This event is open to anyone. It's happening on May 17th, and you can register at triagecancer.org/conferences. If you are a healthcare professional, we have an insurance and finance intensive for you. We have 3 more left online and 3 left in person this year, and you can register at triagecancer.org/intensive. And if you are a community health worker or frontline public health worker, we have an Insurance and Finance 101 training for you on June 25th, and you can register for that training on our website. And as a reminder, we do have a legal and financial navigation program where we provide free one-on-one help for individuals diagnosed with cancer, caregivers, and healthcare professionals. You can start by filling out the intake form online, triagecancer.org/get-help. We also have this form available for you in Spanish. And please stay connected to Triage Cancer by attending the rest of our webinars, keeping up to date with our blog. Connect with us on social media. Our handle is @triagecancer. And order materials by using the material request form on the screen. Next slide, please. We have launched our Flower Power fundraiser, so if you like gardening, you can order bulbs, herbs, gardening supplies, and more, and Triage Cancer receives 50% of the profit. We are grateful for any and all contributions. And we want to hear from you, so please scan to share your experience or visit triagecancer.org/testimonials. For those of you requesting CEs or contact hours, you must have registered online for today's session, attended the entire webinar, and you must complete the evaluation and post-test within 1 week of the webinar. An email from Zoom with a link to the evaluation and post-test will be sent 24 hours from now. And nurses and social workers only, you must receive a passing grade on the post-test of an 80% or higher. So if your screen looks something like this, then you have passed and you're all good to go. However, if your screen looks like this, then you did not pass, but a link to the post-test will be displayed and you can copy and paste that link into your browser. You have 1 opportunity to retake this, and certificates will be sent within 4 weeks. Thank you all so much for being here, and we hope that you have a great rest of your day.